Good morning, good afternoon, and good evening to everyone joining us for the second session of our alumni webinar on Seafarers' mental health and well-being. A warm welcome to our WMU alumni. It's fantastic to see so many of you here with us today. This session is titled Seafarers' Mental Health and Well-being, Lives and Dignity at Sea. Today, we are excited to bring together researchers who combined four recent studies featured in a special issue of Inquiry Journal, the Journal of Healthcare Organization Provision and Financing, published by SAGE. We are grateful to SAGE for helping to highlight the crucial work and life of seafarers through this publication. Just a quick note, this webinar will be recorded, the recordings will be shared, and we will answer some of your questions. The answers to our questions will be sent to you in written form. I am pleased to be hosting today's webinar together with Dr. Maria Carrera, a lecturer and researcher at the Maritime Safety and Environmental Administration at WMU. My name is Inga Bartusevičienė. I am Associate Professor of Maritime Education and Training, specialization here at WMU. In our first alumni webinar session, Translating Research into Practice, four presenters shared valuable insights. The panel ended with a clear call for action. Seafarers deserve the same care and standards as everyone else. Panelists suggested practical ways to support seafarers' mental health, such as updating on-board psychiatric medications for urgent needs, offering culturally familiar food to create a sense of home, providing internet access to keep connected with loved ones, ensuring balanced work, rest, and sleep hours, and fostering a culture of trust and mutual support. Today, the researchers and the panelists will present their research on employment practices and food provision, sexual abstinence at sea, sleep conditions, and role of information and communication technologies. We hope this webinar provides opportunity to share recent research, reconnect with WMU alumni, and strengthen the global maritime network. By building partnership, we can work together to tackle the critical issue of seafarers' mental health and well-being. We think that only working together, we can create a healthier, more resilient workforce ready to meet the demands of this essential profession. Now I will turn over to Dr. Maria Carrera, who will introduce the panelists and their presentations. Maria, please, over to you.
Thank you very much, Professor Inga. My name is Maria Carrera, and I am a lecturer and researcher at the World Maritime University. A big welcome to everybody, both the panelists and also the audience. Just a reminder that to the audience that you can post your comments and also ask your questions during today's session on the question and answer chat. Some of these questions will be resolved today, and the remaining ones will be follow up after the session and shared with you via email together with the recording of the session. Dr. Inga has summarized the main conclusions of the previous session, underscoring the importance of assuring a workplace in which seafarers are not treated differently or have lower standards than other professionals, then deserving a decent and healthy work culture and work place. Our today's panelists will scrutinize some of these standards, including food provisions, sleep conditions, or sexual health, and their contribution to seafarers' mental well-being. And will also examine how to improve mental health attention and services for seafarers. The presentations will be followed by a panel discussion in which our researchers will be joined by Mr. Charles Watkins from Mental Health Support Solution, a maritime clinical psychologist and psychotherapist, and then all together we'll discuss how to translate research into action and build a safer, healthier, and more decent work environment for sea workers. And now I would like to invite our first presenters to take the stage. Dr. Paulina Baum-Tamor, Ocean Nexus postdoctoral fellow at Dalhousie University from Halifax, Canada, and Dr. Çağatay Edigan Sahin, professor from Ordu University, Turkey, who will present the work employment practices, cost minimization, and their implications for food provisions and seafarers' well-being on board ships. This qualitative study that applies shipboard observations and seafarers interviews has investigated the impact of cost minimization on food provision and insecure employment. So whenever you are ready, Dr. Paulina and Dr. Çağatay, please, the floor is yours.
Thank you so much, Inga and Maria. We appreciate it. It's great to be here. So my name is Paulina.
My name is Çağatay. We are here to present our paper titled Employment Practices, Cost Minimization and Their Implications for Food Provisions and Seafarers' Well-being on Board Ships, a qualitative analysis, which is based on the work we did relating to precariousness of employment. The paper reflects on an important aspect of diverse aspects of food and nutrition on board ships. Now, in terms of the things we will be covering in the presentation today, we'll start with an introduction to the global shipping industry. We'll be talking about seafarers as the workers of the sea, globalization and how it impacted seafarers' employment in the last 4 or 5 decades or so, focus on work conditions on board, using food as an example.
So the global shipping industry, maybe more than any other industry, has been greatly influenced by globalization and cost-saving practices over the past few decades. In a typical scenario, as most of you are probably familiar with, the ship owners can be based in Germany. Ship flies a Panama flag. The crew is recruited through third-party recruitment agencies from Europe, Ukraine, Russia, the Philippines, and the ship might be carrying containers from the US to Spain. So globalization pretty much shapes employment in shipping, including the composition of workers on board ships and their work conditions. One important change relevant to flexible employment in this respect relates to the practice of flagging out, or flags of convenience, which means that when a business practice that ship owners take, register merchant ship in a ship register of a country other than that of the ship owners, and the ship flies the civil ensign of that country, called the flag state.
There are about 1.89 million seafarers working in this industry worldwide, and the drive to reduce labor costs and additional processes relating to globalization have created a strongly insecure work environment for seafarers with minimal regulations of work conditions. Seafarers work on short-term voyage-based contracts, at the end of which they become unemployed, and they lack many social benefits like pension schemes, and there are generally precarious work practices for seafarers globally.
So in our research, we focused on cargo container ships for the field work. Seafarers' work arrangements on these ships often linked to fatigue, and also, as surprising as it might be, even in 2024, many ships nowadays do not have a reliable or affordable internet connection. It sometimes takes weeks before they reach port, spending time away from their families, often for 9 or 10 months contract at a time. In COVID times, it was, as you're, again, probably familiar, it was even as long as 2 years before they could be repatriated home due to delays in crew changes without actual guarantee for the next contract. And in addition to that, seafarers' work at sea is dangerous without immediate access to medical facilities in an emergency.
The information used in this paper is based on the data collected in 3 separate research projects conducted between 2010 and 2023, where supplementary data on food arose during the data collection. We used a qualitative approach, including observation on board ships, interviews, and conversations with a total of 159 participants from over 20 countries, relatively representative of the global seafaring manpower.
So when we say food on board ships, how many of you think it looks something like this? So basically, it makes sense because a lot of our familiarity with food on board will come from cruise ships or ferries. Some seafarers might feel that food is very important, especially after mentioning the work conditions they experience. So it might be one of the only comforts they have on board in terms of like their welfare. So if I ask you how many of you had, ate breakfast this week, right? I'm sure you had many options to choose from. You could go to a coffee shop, you could go to a restaurant, takeaway. So seafarers experience a different reality where takeaways and restaurants are not an option, especially on voyages that can last a few weeks to a few months at a time. They really depend on the ship to provide them with all of their basic needs, including food, which makes it quite an important aspect of life and work at sea.
Well, in reality, food on board cargo ships is quite different and looks more like this. Ships that in many cases carry the food we consume on a daily basis. In this backdrop, some of the challenges relating to food can be no control over the selection of food, irregular meal times due to the shifts on board, unexpected events on the ship like engine failures, storms, pilot on board, exceptionally high level of stress, limited opportunities for physical activities in leisure time, consumption of unhealthy and comfort food.
So the Maritime Labor Convention incorporates guidelines relating to food on board. So for example, minimum requirements for and standards for food. However, as Oldenburg and others state in their paper from almost a decade ago, a critical appraisal of the Maritime Labor Convention reveals that the nutritional situation on board is neither standardized nor mandatory, but adapted to the standard of each member state, which makes it quite gray area in terms of regulation and enforcement of standards worldwide. Also, the types of food seafarers eat and the quality of food that they are served on the ship.
In fact, there have been cases as recently as during the past 2 years where crews were reportedly starving, ran out of food, or not provided with the basic food and drink while at work. The reported cases are generally addressed through poor state control where the ship is berthed, but there are many unreported cases relating to food. Even as recently as this week, we heard reports of crew being fed expired food on board. Some cooks shared that if they sold the company, they could work with what they have and not to complain about substandard conditions on board, and they were likely to keep their jobs with the company. For example, Barto shared, because it's an old ship, galley hot plates heat up very late, so I have to wake up earlier. Also, the drains, which are very important for cleaning, must be working well. If they are not, it's a lot of additional work for the cook and the steward. The additional work Barto had to undertake to compensate for the old equipment on board was added to his daily workload, which is reportedly already high and intense when working on board cargo ships for extended periods.
Now, in other cases, some cooks were trying to implement their training, but the circumstances in reality led to reduced quality of food served to seafarers, food waste, and falsification of documents. This is just an example of ship operations that took priority over seafarers' welfare. So Bekir shared, the company told us to get the ship to Turkey safely and not to worry about the rest. The food was already disastrous. I lost 10 kilograms, but everyone, the captain and the chief engineer, had the same food. And who would have a reaction to that? Meaning that if they didn't complain, who am I to complain? Bekir shared his experience of poor nutrition on board. Other seafarers also shared how low quality food was brought to the ship to cut costs.
Another aspect of food relates to seafarers' health. Seafarers have limited options on the ship as they cannot order from a takeaway restaurant or to go out buy groceries. Food is often perceived as one of the only comforts on board, considering the oftentimes stressful work environment. Food, however, is not always considered healthy food, as illustrated by Oberyn, a 40-year-old chief officer from Ukraine. It's good to have a nice meal. I mean, no one is on diet here. As a rule, I gain 10 kilograms for every voyage because we don't have any other enjoyment. So one of the pleasures on board is consuming food. I'm busy with the computer. There are constantly decisions to be made, what comes in, what comes out. So I have to eat properly. That's why I gain weight, because the food is not always healthy. It has more calories than at home. In this respect, in their paper on the changes in seafarers' health between 2011 to 2016, Sampson et al. State how consumption of fried food at sea is far higher than consumption at home. The cook plays an important role in this.
So food waste by cooks on board substandard ships was also mentioned by seafarers, who generally explained it by saying that cooks wanted to lower their workload and not work as hard. Bakir described how one cook deliberately leaves the door open so that the fruit and vegetables spoil, so that he doesn't have to catch the vegetables. The company bought 3 small watermelons for $40 each. He cut one and we ate it, but the other 2 rotted. So the cook's behavior links to food waste, lack of motivation, and precarious working conditions can be explained by previous studies that focused on the expected and perceived workload of workers, where workers reduced their productivity when they did not feel supported by their employer. Just to sum up, the purpose of this paper was to shed light on the current situation on board ships in relation to food. The precariousness of employment on board ships significantly influences the food situation and quality experienced by seafarers. These conditions, coupled with the lack of employment stability, pose challenges for maintaining adequate and nutritious meals on board. Cooks were shown to struggle to allocate sufficient time for meal preparation and have limited access to fresh ingredients, impacting the variety and quality of the food served on the ship.
Based on the issues we raised, here are 2 of our recommendations. Firstly, we would recommend maritime training institutions offer standardized training programs for cooks on board and for shipping companies to invest in such training. Secondly, shipping regulatory bodies should consider developing standardized menus that consider nutritional requirements, cultural diversity, and crew preferences. We encourage the readers to continue exploring issues relating to food on board, considering the complexities. Further exploration of food on board could include an exploration of seafarers' meals and calorie consumption. Further investigate education relating to cooks training on board in a comparative study across several geographical areas, and address food provisioning in different contexts, including potential gaps between regulations and implementation. Here is some bibliography for your reference.
Yeah, as we mentioned before, the slides will be made available, and we have some kind of extra bonus slides if someone wants to explore the issue further and take it to the next step. Thank you so much for your attention.
Thank you.
Thank you. Thank you very much, Dr. Polina and Dr. Chatai, for your timely research and your excellent presentation. In fact, it's a reminder for the industry that the kind of standards that we are still offering to seafarers on board ships in comparison with other human beings, in comparison with other professionals. And what it's not just your study, but there are other studies that report very recently about shortages of drinking water for free on board vessels, and also this kind of standards for food that must be not just nutritious food, but also balance, including in terms of quality, quantity, and diversity. So I don't see any question from the audience yet. I think they are still quite shy to ask questions, but I have a question for you, because you mentioned the Maritime Labour Convention and the importance of regulatory matters. And I think in the latest amendments to MLC 2000 2006, which will enter into force in December this year. I think that there are new provisions about guaranteeing drinking water for free for seafarers, and also this kind of well-balanced meals for seafarers. So how much important is the regulatory aspect in elevating the conditions, the standards for seafarers, and if you think that this is not sufficient and something else must be done in the industry?
So it's definitely important that there were changes. Unfortunately, these changes are always, as most of us familiar with, they're not as fast as they should be. And the problem also falls on the implementation and enforcement. So, for instance, on the substandard ships that my colleague investigated, obviously he can say it better, but from my experience of his stories, there's a lot of falsification of documents. So even if they say they're doing everything by the book, it's not necessarily going to be the case. And due to different factors, these cases are not necessarily going to be heard about or taken care of, which means the regulations in this case might not be relevant. So it sounds very, very glum, but I mean, I feel that the industry is doing a lot, especially the bigger companies. But there's still cases that are happening, and continuous welfare organization, like the work they do, is amazing in terms of like addressing these issues and bringing it to the attention of port state control and the ITF. It's just about kind of making these cases known and taking care of that, because if people are not speaking up about the conditions on the ship, there's not much that can be done about it. And it's one of the problems, they are in these conditions because of these precarious employment practices where they feel insecure in their employment. So they are afraid to say anything, because if they say something, they might be blacklisted or not giving additional employment opportunities, which for them it can be life and death matter. So yeah, I'm not sure if I answered the question, but that's
Thank you very much for your clarifying response indeed. Yeah. And yeah, we should move on now and invite the next presenters to the stage. These are Mr. Bin Dong, a seafarer and who holds a master's degree in maritime affairs, and who works for COSCO Shipping Seafarer Management Company in China, and Dr. Jackie Tan, associate professor from Dongbei University of Finance and Economics in China, who will present the work entitled Work-Induced Sexual Abstinence and Psychological Health of Chinese Male Seafarers. They present a groundbreaking study that explored, based on a survey of 617 respondents, the impact of work-induced sexual abstinence on the psychological health of Chinese male seafarers, contributing to the scarce literature on seafarers' sexual health. So, Mr. Bin Dong, Dr. Jackie, please, the floor is yours.
Okay, so good afternoon, everyone. So thank you for the opportunity to present our research here. So our topic today is the relationship between work-induced sexual abstinence and the psychological health of Chinese male seafarers, the positive influence of job satisfaction. So my name is Jackie, and I will do the presentation on behalf of the co-author, okay, Mr. Bin Dong, okay, from COSCO China, and Dr. Maria and Dr. Rahul from World Maritime University. First of all, I want to say this research becomes very meaningful. It's actually because of our first author, Mr. Bin Dong, who is a seafarer himself, okay? So we believe, okay, so this research is really conducted from the reality and make the results very meaningful, okay? So this is the content of our presentation today. So as everyone here know that, okay, Seafarer actually has a very special working environment, and they actually will be away from their partners, families, and shore life for long periods and work long periods at sea. Therefore, seafarers suffer many challenges in the workplace, including the frustration of their sexual needs. So our study aimed to investigate the relationship between work-induced sexual unbusiness, psychological health, and job satisfaction among seafarers. So we hope we can actually establish an effective maintenance framework to address the sexual unbusiness issues, okay, and to better protect the health and psychological well-being of seafarers. So in order to achieve the overall research purpose, we actually conducted a very comprehensive literature review in the areas of seafarers' working conditions, seafarers' health, including the mental health and sexual health, and also some literatures related to the sexual and business issues. We actually noticed that hardly there is any research, okay, that try to identify or explore the mental or physical impacts of sexual unbusiness for seafarers. We do notice that there are some literatures discussing the seafarers' mental health, okay, and some discuss the sexual health of the seafarers while they are working on board, okay, but there was no research that directly focused on the influence of the sexual unbusiness for seafarers while they are working on board, and what kind of effect it may cause on the mental health. And we also develop a kind of hypothesis that job satisfaction can actually have some influence on seafarers' mental health, okay? And we actually noticed that some research target to this kind of research hypothesis, but we actually noticed that no direct study analyzed the relationship between job satisfaction and work-induced sexual unbusiness on ships. Okay, so based on the above discussion, we actually proposed a kind of research framework like this. Okay, so we try to use a large sample of Chinese male seafarers. Okay, and we try to investigate the influence of sexual unbusiness on their psychological health. We also want to explore the extent to which social demographic, job, and company characteristics of the seafarers, together with the onboard welfare and facilities that they experienced on board, affect such influence. And also the psychological health dimensions assessed includes seafarers' emotions, cognition, functioning, relationships with others, and psychological problems, okay, will be explored. Furthermore, the relationship between job satisfaction and the level of tolerance to sexual unbusiness for seafarers is identified. So this is our research framework. And in order to achieve our research objectives, we try to deploy the methodological triangulation. That means we try to use both qualitative approach and the quantitative approach. For the qualitative approach, we conducted the semi-structured interviews with 5 Chinese male seafarers. The purpose for this qualitative approach is to provide very meaningful and enriched information, okay, contributing to the research objectives. And also, we want to use the information generated from these interviews to help us to develop the questionnaire we will use for the second step, which is the quantitative approach. For the second step, which is the main part of the research, we try to apply a kind of quantitative approach, and we do the questionnaire-based survey. Okay. And for the questionnaire, okay, we try to design the questionnaire mainly using the 5-point skill questions. And we develop the questionnaire into 5 parts, and we try to explore the social demographic information and the employment characteristics at sea for the respondents, and we try to explore their perceived job satisfaction, okay, based on the job descriptive index. And we ask their tolerance level to sexual ambitiousness, as well as the psychological impacts after experiencing the ambitiousness. And for this part, we design a question based on the psychological health index of Chinese adults, okay? And finally, we also ask the respondents to indicate the availability of onboard welfare and recreational facilities. So we try to distribute the questionnaires between 6th of May to 20th of May in 2021, okay? And we try to distribute our questionnaire through the very popular social networking service among Chinese seafarers, which is WeChat. As I mentioned, our first author is a seafarer himself. So he actually has a strong network among the Chinese seafarers, making our data collection a little bit easier. We try to apply the hierarchical cluster analysis and multiple linear regression analysis to analyze the data. So this is our results, okay? So during around like 20 days, we actually received around like 617, okay, valid respondents. And all the respondents were Chinese male seafarer, okay? And because during the data collection period, okay, so that is the pandemic COVID-19 period. So all the respondents, they are actually working on board, and they had no opportunity to have a short leave because of the pandemic. So they actually suffered a long time of sexual ambitiousness, okay, while they are working on board, okay. And we actually noticed that, okay, so we have most of the respondents got married, okay, and and a large of the sample size, they actually fall into the age cohort 30 to 40, okay, and we actually collect the data, okay, from the seafarers on different ship types, and also they have different types of ranking. So we believe our data is quite representative. And as I just mentioned, okay, we try to use the hierarchical cluster analysis to do the data analysis, okay? So we actually use the psychological related questions to do the clustering. And we actually got this cluster solution. We feel very great that we typically identify 4 groups of respondents, okay, and we name them average, adapter, seafarer, and stand, okay? So for the average group, that means they actually experience mild psychological health issues, but their reactions remain similar to most people experiencing sexual ambitiousness, okay? And this group of people accounts for around like 30% of the respondents, okay, of the total respondents. And the second group is called adapter, which means they did not express highly negative feelings or emotion except for homesick, anxiety, and loneliness, okay, which is very common for people after experiencing some like psychological problem, okay. And also we have a group called Seafarer, okay. This group is very typical, okay. So they actually express, okay, strong, okay, psychological reaction after experiencing sexual ambitiousness, okay. And okay, even some of them claim they actually had suicidal thoughts, okay, after experiencing the sexual ambitiousness, okay. And the final group is called stand, okay. So this group is also very distinct because they actually claim nothing, okay, after experiencing sexual ambitiousness. They did not develop any psychological distress, okay, associated with sexual ambitiousness. And through some ANOVA test and the compare of means, we actually noticed that, okay, for the stand group, okay, who 90% never experienced psychological problems after experiencing psychological and business, we noticed that this group of people, they actually experience a better education background, okay? Some of them actually has working experience with female seafarers, and they actually had shorter contract period and had higher frequency for shore leave while they are working on board, and they experience better onboard welfare and facilities. Well, for Seafarers, okay, who were strongly influenced by the sexual and business, we actually noticed that, okay, they actually have longer contract period, but shorter holiday period, okay, and they have less shore leave opportunities, and they actually experience poor onboard welfare and facilities. And for the multiple linear regression results, we try to identify the relationship between the job satisfaction and tolerance level to the sexual and business, okay? So we actually noticed that the overall job satisfaction, perceived working environment, ability utilization for other jobs, own choice of working as a seafarer, and perceived friendliness of co-workers had a positive influence, while the job responsibilities had a negative effect. So based on the results and findings, we actually developed a kind of like effective management framework for the consideration of the ship company and also relevant stakeholders. We do believe, okay, the seafarer, they actually need mental health monitoring and psychological support while they are working on board. We actually noticed that before the seafarer work on board, they need to do some like mental health test, but we actually ignore that, okay? While they are working on board, they probably also need a kind of like continuous monitoring on their mental health, particularly after they experience long-term sexual and business. And we do believe they also need sexual-related education. This can help them to reduce the psychological pressure and also contribute to protect their psychological, to contribute to protect the sexual-related health of the seafarer. And because of our result, we do believe shorter contract period, okay, and the better shore leave opportunities, and also better onboard welfare and the facilities is important to the seafarers, okay? And more importantly, we believe if it is possible, we can create some opportunity for the seafarer, for the male seafarer to work together with the female seafarer in the future, and also better education background can reduce the impact of the psychological health problems. So we believe our research has a lot of like practical implication. Okay, so this is the very first research that identified the relationship between work-induced sexual ambiguities and the psychological health of Chinese male seafarers. Okay, and also we proposed a very effective management framework. Okay, and also for the theoretical contribution, we actually identified the correlation between job satisfaction and the tolerance level of seafarers to sexual ambiguity. Okay, so that's the end of my presentation. So thank you for your time, and questions are welcome. Okay.
Thank you very much, Dr. Jackie and Mr. Bindon, for your insightful presentation and this novel research you have conducted. It was good that something motivated you to conduct this research, and it's a reminder also to the industry that somehow we are ignoring some human needs and some aspects that are important for all individuals. So I have now the audience is becoming more active and asking many questions. So I will choose one that comes from Octavian. And the question is, how open were the Chinese seafarers to the research and to being interviewed, sharing this kind of personal information about their sexual needs and related aspects? Thank you very much.
Okay, so thank you for your question. So we actually suffer some problems when we conduct the interview with the Chinese seafarers, okay? Because, you know, this is a very sensitive topic, okay? At the very beginning, okay, very few seafarers prefer to conduct the interview with us, okay? So we only have the opportunity to do 5 interviews, okay? And for these 5 interviewers, okay, they really understand the meaningful of this topic. So they are quite willing to share their ideas with us, okay? And they talk very frankly about their experience after suffer sexual and business, okay, around like 2 to 3 months while they are working on board, okay? And we talk very frankly, okay? And they also provide some examples what kind of like psychological problems they may experience, okay, after experiencing such kind of like influence on board, okay? While for the quantitative approach, okay, because it is anonymous, okay, so people fill the questionnaire online. We do feel, okay, so it is very easier to collect the data, okay, and we notice that, okay, the Chinese seafarers want to share their some perceptions or want to share their experience, okay, after experiencing some like sexual related problem or psychological related problems, okay. We do believe face-to-face interview is a little bit difficult, okay, because of the sensitive topic, but the quantitative approach, okay, we can actually get the data not that difficult, okay, yeah.
Thank you very much, Dr. Jackie, for your response to the audience question. And yeah, there are more questions coming up, for you and also for the previous presenters. But yeah, you will answer these questions live or later after the session. Because now we need to move on and ask or invite the next presenter to take the floor. He's Mr. Marko Galic, who holds a Master of Arts and works for the University of Zadar in Croatia for the Quality and Lifelong Learning Departments. The work he's about to present is entitled Mixed Methodology Approach to Seafarers Sleep on Boards, that apply a mixed method approach to investigate Croatian seafarers' challenges in maintaining sleep quality at sea. The study tested the mediating role of good sleep between job satisfaction, mental health, and somatic symptoms. So whenever you are ready, Mr. Marko, please, the floor is yours.
Good afternoon, everybody. Maria, thank you for your introduction. Thank you for the invitation. It's an honor to be here with you today. I would like to greet you not only in my own name, but also in name of my colleagues, Leon Sic and Dana Slišković. As a small research team, we conducted this study. To begin with, I would like to point out how stressful, according to previous studies and findings, seafaring as a profession is. Literature often mentions long working hours, low levels of control, and low levels of support on board that lead to different kind of problems, including fatigue and also mental health problems such as depression, anxiety, burnout, and also health-related problems with different kind of chronic pain. What we know is that in last 100 years, working hours have doubled. This means that compared to previous periods, seafarers work much more. One of possible explanations is globalization and fourth industrial revolution, because information travels much faster and emphasis is put on capital. What we wanted to study is the relationship between somatization, and somatization can be defined as a tendency to experience and express psychosocial stress in a form of body response. But at the same time, your body response to somatic or physical symptoms doesn't have a clear physiological explanation. Most usual somatic symptoms include cardiovascular, gastrointestinal, musculoskeletal pain, and fatigue. Fatigue is extremely alarming because it disturbs circadian rhythm, and disturbed circadian rhythm has been shown to affect physical and mental health outcomes. Job satisfaction can be seen as a construct in which participant or employee assesses his global satisfaction with his work and workplace. And we decided to use mental health definition of mental health imposed by World Health Organization, which says that health is not the absence of the disease, but the ability to actively contribute to the community somebody lives in and answer to normal life stressors. Regarding our research problems and hypotheses, as Maria said before, this was a mixed method study. So in the first part of the study, we used quantitative design, and we wanted to investigate the mediating role of the quantity of sleep on board, operationalized as number of sleep on board in one day, between job satisfaction and mental health, which were seen as potential antecedents of somatic symptoms. Qualitative study, the other part of our research design, wanted to gain a deeper insight into the experience of sleeping on a ship. So first study, this is what I already said. We applied sequential explanatory design, which means that we first had quantitative part of study in 2019, and then qualitative part of study in 2021. Quantitative study was paper pencil form, while qualitative study was in online questionnaire. In study 1, quantitative study, 286 Croatian seafarers participated. Mean age was 37.5 years, and most of them worked in international shipping or for international organization. We applied mental health inventory, job satisfaction scale, and patient health questionnaire. We had one question for sleep on board. We asked them how many hours a day they sleep on board. This data was analyzed using PET analysis. In the second study, qualitative one, 205 seafarers participated, and 80 of them said that they had sleep problems on board. Mean age is quite similar to one in the first study. Seafarers answered to open questions, such as describing difficulties that they have with their sleep on board, when do these difficulties happen, and how they affect their functioning and how they cope with these difficulties. Data was analyzed with thematic analysis, and epistemological basis was post-positivism. These are descriptive parameters, so it can be seen that, and also metrics of correlation. Job satisfaction was positively associated with mental health and sleep on board, while negatively associated to somatic symptoms. Mental health was positively associated with sleeping on board and negatively with somatic symptoms, and sleeping on board was negatively associated with somatic symptoms. These are the results of PET analysis, but I believe it is better to show you the picture. So job satisfaction, both directly, higher levels of job satisfaction directly contribute to lower levels of somatic symptoms. However, job satisfaction indirectly through longer sleeping on board contributes to lower level of somatic symptoms. Mental health, higher mental health directly contributes to lower level of somatic symptoms. These are the results of thematic analysis. 3 main themes emerged: difficulties, sleep on board consequences, and coping strategies. The results of qualitative study are very important because they give a personal point of view of seafarers, because while reading the answers and trying to organize them, we saw what strategies they use, from taking medications because they can't sleep, or drinking excessive amount of coffee or energy drinks, to not being able to make good decisions, or having slower reaction times that can lead to potentially harsh consequences that include safety on board problems. Why is our study important? I would like to start with job satisfaction as a predictor that both directly and indirectly through sleep on board contributes to mental health. Previous studies have shown that higher job satisfaction of seafarers contributes to lower burnout, lower intention to leave profession, and also higher motivation to respect safety procedures. Why is this important for seafaring organizations and employers? Because we also know that basis of job satisfaction has been shown to be resilience, personal and personal hardiness. So seafaring organizations should try to organize secondary level interventions in form of educations that would build stress coping techniques, and we know that happy worker is a productive worker, and our study showed that job satisfaction directly contributes to lower level of somatic symptoms. To move on, on the mediating role of sleeping on board, Alice concluded that less than quarter of seafarers have average rest. What does this mean in practical terms? That sleep hygiene programs should be tailored not only for a particular employer, but also to on individual level, and see how different seafarers experience different problems. I already mentioned potential safety problems, because slower reaction times and inability to resonate may lead to bad decisions. I would like to highlight potential role of chronic pain that we haven't included in our study. Why is this important for future? Chronic pain has been shown to affect circadian rhythm, and we know that circadian rhythm of seafarers, because of the nature of their job, of their profession and their calling, is very often disturbed. So if anybody is planning to conduct a study on seafarer sleep, it would be good to include chronic pain as a potential variable, a construct. Limitation of our study is that it's a cross-sectional study, and we are not able to make conclusions that are based on causality between constructs. And from psychometrical point of view, we had only one question for measuring sleep on board. Therefore, future studies should be conducted longitudinally and on more diverse seafarers samples, because it's possible that seafarers from other country might have different experience. That's all from me, from our research team today. Thank you. I'm able and willing to answer your questions.
Thank you very much, Marco and collaborator for this interesting and very much needed study that reminds us again, it reminds the industry of long-standing issues in the industry, right? Like quality of sleep, and which is something that reiteratively appear on research. So I would like to ask you a question that comes from the audience because there are several questions here. This comes from Jessica, and she says, good afternoon, much needed topic. Thank you. Shorter contracts often mean no vacation pay for seafarers. Any suggestion how to balance the aforementioned?
Thank you, Jessica, for the question. Maybe I won't be able to give satisfying answer at the moment. Maybe during our discussion later we can come to a better conclusion. But in my opinion, it is very important, and at first place, to try, if we are talking about primary level interventions, to respect the duration of the contract. That is the first point to be made. Maybe Mr. Watkins can join now or later regarding the length of contract, but it is very important at first place to respect the length of contract, and then we as academics can try to reach other stakeholders regarding the optimal length of contract, as we know at the moment that contracts that are as long as the rest period on shore have better health and life satisfaction outcomes than contracts that have unequal periods on board and ashore. I don't know if this helps, but I tried.
Yeah, thank you very much, Marco. And indeed, there are many other questions that ask about if there is in the regulations any maximum time, of contract, length of contract. But the response is that not at this moment. We don't have a limiting for how long a seafarer can be on board. But as far as I know, this is a discussion that is happening right now, thanks to studies like this at the IMO and the ILO. So at some point, probably from a regulatory point of view, we can see some, okay, Paulina, you wanted to say something, add something.
Yeah, I just wanted to mention that there is a limitation. According to the MLC, it's up to 12 months, but obviously in COVID times, it wasn't followed because of like special circumstances, but there isn't sort of specific by country, and shipping companies in many cases just decide on their own regulations. So it's not standardized in terms of how long particular nationality will be serving, and depending on the roles as well. So just wanted to.
Thank you, for pointing that out, that that's for the maximum time on board. But there are also questions about for specific contracts, if there is a maximum of 3-6 months, but for the total, of course, the limit of the regulation is 11 months, right? So thank you for pointing that out. And let's move on to the next presentation. It's last but not least. We have now the study conducted by Dr. Stanley Avila, who is an associate researcher from the Seafarers International Research Centre in the UK. The study he is about to present concerns the role of information and communication technology in seafarers' well-being. The study has applied mixed methods, which included 26 interviews and a survey of 817 seafarers to examine how information and communication technology and formal education might empower seafarers in health promotion. So, Dr. Stanley, please, whenever you are ready.
Thank you, Maria. Thank you for having me here. And of course, thank you again to Maria and our colleagues who edited the special issue from which this presentation and our paper was published. So my presentation is just a part of what we did back then in 2021. So we had a pilot study on the psychosocial interventions provided to seafarers during COVID. It was funded by a British NGO. We were a team from the UK, of course, here from the Philippines and Sweden, Momoko of WMU. Because it was COVID, so there was some kind of a it was easy to sell back then because most people were quarantined, and we were surprised with the number of respondents that we had back then. Our data collection had 2 stages, and these were conducted from March to about September of 2021. And out of these small pilot study, we managed to publish a report, which is also available in WMU's library, and 3 articles and some conference presentations. And from this study, we also managed to get further funding regarding mental health education of seafarers. So my presentation is a bit of is actually based on our work in this special issue. So also I would like to thank my co-authors, Momoko, Rhea, Legion, and Rafi. They're not here because they're busy. And so I'm tasked to present this, at least a bit of what we did. So because we have quite a rich data, we managed to reflect on some few things. And for my presentation, we really asked ourselves, do seafarers, are seafarers using information and communication technologies effectively as a means to improve their mental health? And more broadly, can we examine whether seafarers are empowered individuals in promoting their health? So these are the kind of questions that led us to examine from a different point of view our research data. So of course, everyone knows ICT. What we are doing right now is because of it. And then the promise of artificial intelligence, the promise and the danger of artificial intelligence is already here. So I'm excited a bit of what AI can do now with hopefully helping seafarers in terms of improving their health on board. But nevertheless, we were intrigued whether seafarers in our study, how do they use technology? Okay? Do they use it to help them improve their health, or maybe not? So so we looked for some theoretical framework to base our study. It's in the paper, and I'm not going to repeat it here. But our concept of empowerment comes from the WHO, and I didn't discuss it here in the presentation, in the slide, but of course, the concept of power of Michel Foucault. Because when you say about, when people talk about empowerment, something to do with how individuals can make decisions about their health. Okay, so are seafarers, are they empowered in the sense that they can make good decisions regarding their health? And of course, probably all of us here are aware of the so-called, our colleague in the previous presentation mentioned Baumler. Baumler is quite famous in capturing the so-called ship-first mentality or ship-first culture in the maritime sector, where the most important thing for seafarers is the ship and not themselves. So in this background, and of course, the Paulina and John mentioned earlier, globalization, all of this come together to create this kind of a ship-first occupational culture, where the most important thing is the safety and the integrity of the ship rather than the seafarers. So against this background, we look at our data. Again, I will not repeat what we already mentioned in our paper, but this is the basis from which we took our data from survey and in-depth interviews. But primarily, we look at the kind of support that seafarers receive. Of course, our data was about what mental health or psychosocial support, MH there means mental health, seafarers receive specifically from their companies. So when we look at our data, so this is just the social demographic profile of our respondents. So when we look at our data, what you see in the screen is a 3-column figure. So on the and multicolored figure. So the dark font is the percentage of type of support from companies. The list of support are in the middle. The blue ones, we argued, are the type of support that seafarers identified that for them has implication for their families rather than themselves. Okay, and the orange ones are the kind of support that seafarers reported, but this type of support are related to self. So this is a kind of a simple illustration that if you look at the figure, seafarers oftentimes receive support that have more implications for their families rather than themselves. Okay, so any support that they receive, they will always look at their families or their loved ones rather than themselves. So this is the kind of impression that we make in terms of the data that we have. Okay, so for example, the highest type of support is you can say it's for crew change during pandemic, and as Paulina said, it was difficult for seafarers to get off and for those who were ashore to get on board. So during the time, it was understandable that they wanted to go home, and for those who were trapped ashore, they wanted to work because for a long time they may not have earned anything. But in terms also of the type of support that they receive through technology. So of course they appreciated more the kinds of technology that allowed them to communicate with their family. So Wi-Fi and the internet were mentioned, okay, as the top two. And but unfortunately, our respondents did not really use mental health support for themselves. So for example, only less than 30% use telecounseling services. And we knew during the pandemic, there was a spike in about psychological problems such as depression, anxiety, and so on and so forth. But only 30% of our respondents of the 817 access telecounseling. Worst are the use of mental health lines, less than 15%. And worst, the use of mental health apps. No? So we argued that seafarers have not effectively used technology-based mental health intervention. And we speculated that probably it's because of they're not comfortable with it. They're mostly men who are not comfortable talking about themselves, especially to strangers. There's still a cultural taboo element in the use of these types of support. While this figure, it shows both the kind of the perception of usefulness of both technology and non-technology based mental health intervention. So what we're trying to show here is that seafarers do acknowledge that there are the usefulness of technology-based interventions. There are also non-technology-based interventions. And if you notice, technology-based intervention is the highest because it's something to do with their family. Okay, and down the line again is they don't find as that useful compared to talking to their families, mental health apps, or outsourced telecounseling services. But of course, seafarers also find useful the positive and collegial atmosphere on board. So these are non-tech intervention that they appreciate. Talking to each other, talking to supporting their fellows were important for them. So I will just jump into my sort of conclusion, which is also based on our paper. So going back to our two questions raised at the beginning of this presentation, are seafarers empowered as individuals? So far, our data says they're not yet that empowered. Okay, the technology is there. but somehow they're not effectively using this technology. Okay. Of course, there are also limitations in terms of technology. If they're in their high seas, they may not have Wi-Fi or the internet connection. Okay, and some of our colleagues here already presented that still Wi-Fi use, quality Wi-Fi, the speed of the internet are still an issue for seafarers, and these are necessary technology for so that seafarers can use technology-based support. And for us, we would argue that we need to develop some sort of formal education on mental health for seafarers. This suggestion has already been, this has not been yet tapped globally, but IMO member states, I believe, have already begun discussing formally training seafarers regarding mental health. I think that's where the group of Charles come in. Okay, for us, we managed to get a small funding to continue our research on the feasibility of creating modules, mental health modules, for now for Filipino seafarers and cadets. We're still on the early stage, but somehow our research in 2021 was a basis for us to get further funding to develop culturally sensitive mental health modules for now for Filipino seafarers, because that's our focus right now. And lastly, the changes in using technology to improve seafarers' mental health and the potentials of mental health education for seafarers are seen as invaluable long-term solutions to empower seafarers in health promotion. So that's it for me. Thank you for listening.
Thank you very much, Dr. Sally, for another relevant and well-designed study. And this is very good. And yeah, there are many aspects that you highlighted and are relevant. So I would like just to pick up one of the questions from the audience, because there are several here. But one is, in my view, also, yeah, very important. Thank you, Sanley, for this presentation that clarifies mental challenges for seafarers. Can you inform us regarding whether some of these challenges you have identified were alleviated after the pandemic passed? What is your experience with this and your studies, Sanley?
Thank you, Captain Mohab. How are you? One of our research mates was originating from China and based in the UK. So he informed me that after the pandemic, especially for Chinese seafarers, the kind of strict regulations used during the pandemic were used more against some Chinese seafarers. So they were, if my memory serves me right, more quarantine. Okay. After we concluded our study in 2021, I stayed in the US for a short research stint. And during that time, around 2022, international seafarers were still barred from enjoying shore leave in some US ports. So I was in California and in New York. They were telling me that international seafarers, after the pandemic was officially ended, somehow some port state controls still use the pandemic as the rules during the pandemic to stop international seafarers to enjoying shore leave. I'm referring to that during the pandemic, shore leave were cut short, or there were no shore leave at all. So seafarers suffered more, and after the pandemic, some of port state control still use those rules not to allow international seafarers to enjoy short shore leave in different countries.
Thank you, Dr. Sanley, for your clarifying response. And now, yeah, thank you very much to all researchers for presenting your work and for your excellent presentations. And now I would like to ask all of you to participate in a joint discussion together with Mr. Charles Watkins. So the research you have conducted in all cases highlight long-standing issues in the maritime industry: sleep problems, food provisions problems, ignoring social sexual needs, low consideration of families when considering seafarers' mental health, and so on. Which, if present, these problems, right, weaken seafarers' mental health, but if given attention, can make a difference in improving seafarers' well-being. So I would like to ask you, each of you, what are those practical solutions that can be created to support seafarers' well-being on board and or ashore? And who would be, in your view, the main stakeholders who should be involved in the development and implementation of these practical solutions? So I would like to start with either Paulina or Chatai, if you can please provide your insights on this to this question. Thank you.
Thank you for the question, Maria. Paulina is just disconnected and she's about to, yes, she's just joined. But actually, I can say that the maritime training institutions can offer some standardization for training programs for the cooks and stewards. So the MLC, not limited with the MLC, the International Maritime Organization can lead such practices and make some examples. And of course, it's pretty hard to organize, I mean, in terms of criminal practices, organize some sort of standardization, because this is a multinational industry. However, in terms of hygiene and other aspects can be standardized these regulatory bodies, and the audits also really important to maintain such healthy environment for seafarers. Also, Paulina may add
Can you just
something.
repeat the question? I disconnected.
Yeah, the question is about the practical solutions that you think that should be put in place in order to enhance and promote seafarers' mental health and well-being, and who are the main stakeholders, maritime stakeholders involved in implementing and developing these solutions.
Yeah, I think, well, I agree with what my colleague said. And also, obviously, I missed if you mentioned the recommendations specific to this that we mentioned in our presentation in relation to specified training and and I mean current organizations that are supporting seafarers' welfare, including the Mission to Seafarers, Apostleship of the Sea, which are global organizations. They are doing invaluable work in that regard of just bringing these stories to whoever needs to hear them, and that actually brings the change in reality as well. And I feel that better communication in relation to any violations, and in many cases, seafarers are not aware of whether what's happening is not actually legal or too scared to speak up, and then obviously connecting them to different networks of other similar employees might be another solution to make a difference, where they will have more information and will know what to do about it. And there's also the International Seafarers Welfare and Assistance Network, the ICE one, who are also doing a lot of work in connecting with seafarers, and with obviously linking to Dr. Abila's presentation. Technology nowadays also plays a role with instant chats, and as soon as even if it's a ship that doesn't have an internet connection, as soon as they reach port, they have the ability to contact assistant networks if they need to, and that's something that could also be a potential practical solution. But again, it all comes down to, do they know about it, and how do they have access to it? So it's advertising, using kind of word of mouth and these networks to spread the word about what's out there and what can be done, because that's, I think, could be the real way of changing it in practice, rather than waiting for slower regulation changes. That's my opinion.
Thank you, Paulina and Chatay. And I would like to ask the same question to Jackie and Bindong, please.
Yeah.
What's your
Okay.
views on this?
Okay, so thank you very much for the question. I do agree with Dr. Paulina. Okay, I think, okay, if we simply use regulations or law, we probably could not fully solve the problem. I think the whole society should contribute and pay attention to the issues of the seafarers. Okay, and particularly we need to improve the social status of the seafarers and make sure, okay, the whole society pay attention to the rights issues of the seafarers. Okay. More importantly, I think the family members of the seafarers should be very well treated. Okay, or be take care of the society while the seafarers being away. Okay, from home and working on board. Okay, probably they may worried about their family members. Okay, so I think if their family members can be very well treated by the whole society, okay, so probably they can actually feel a little bit better while they are working on board. Okay. Meanwhile, I think, okay, different kind of like ships, they hung different flags. Okay. But I think the Port Authority (PIC) can actually take some actions while they do the safety check. They can also do check for the living standard, working environment of the seafarers to enhance the rights of the seafarers. Okay, so that is the opinion from me and from Bindo. Okay, yeah, thank you.
Perfect. Thank you so much, Dr. Jackie. And how about Marco? What do you think, Marco, about these practical solutions that can be put in place?
Well, I would like to add on and build up to colleagues' responses. I believe that whole picture is very wide and that different stakeholders, including academia and employers, IMO, and other regulatory boards, should be all part of trying to find good solutions to empower seafarers to be more resilient and to improve their quality of life. Primary interventions, which I talked about during my presentations and in answering questions, are important not only for the sake of respecting contract periods, but also to improve life conditions on board. You mentioned before free access to water, but also free access to internet can add up to Jackie's answer to be able to reach families, friends, relatives, and also to have, except internet and water, to have space for leisure activities, to have high quality and nutrient food. What else can be done in terms of our work and our research is to build on through secondary level interventions and different kind of educations about mental health and sleep hygiene, awareness how important is to have regular rest, to have at least 6 or 7 hours of sleep, and to be able and empowered to work well and contribute not only to their employer but also to themselves in the long term.
Thank you very much, Marco. I would like to ask the same question to Dr. Sanli, please.
Sorry. So I have time to type in my answer because I was listening to everyone. So I'll just read what I typed in. So for the practical solution, in the past few years, I think with some colleagues who've been advocating to formalize mental health education through either company-based or school-based training, where seafarers are taught the fundamentals of mental health, including what my colleagues have just said. mental health studies are always related to good sleep, good nutrition, sexual needs, and other stuff. So it came out from our own data. For now, unfortunately, research data paints quite a bleak picture of the mental health of seafarers if they work longer in the industry, meaning there is now data that the longer the seafarer work in the industry, the poorer the mental health that they have. Okay, so relatedly, the key stakeholders are the usual suspects: the IMO, maritime states, maritime schools, NGOs, seafarers unions, mental health experts, and companies. For me, are the main stakeholders to develop kind of a good mental health education. I think it should be cultural, gender sensitive. Okay, so generally those are the broad strokes for me of what mental health education is. How does this relate to technology? Technology is in terms of technology, they're just there. But if our seafarers don't see themselves as empowered, they don't see themselves as they have the capacity to maybe take care of themselves while they're on board. Okay, and even just to slowly break the silent the culture of taboo, especially among male seafarers, to talk about mental health issues. If we can do that, then maybe we're in the right direction. Thank you.
Thank you. Thank you very much, Dr. Sanley. And now I would like to invite Charles Watkins to join the conversation and provide his insights on what is being discussed. From your clinical experience and practical experience, Charles, what are these practical solutions that you think that are more important and relevant at the moment, and how this could be implemented?
Yes, thank you. First of all, thank you everyone here for doing such an amazing job on all this research. This is invaluable. This is so much needed. And yeah, the more we have, the better, and the more chance that we have for real change. Practical solutions. The research is pretty clear. I mean, well, all these very smart people have put together very clear guidelines, and it shows the biggest impacts, which is shore leave, sleep, fatigue. Let's start with shore leave. Yes, a significant factor. But the question is, why is it not being used? Why is it not accessible? First of all, we need to make sure there's not a culture of indirectly, because on the vessels that I visit, some of the vessels, or the companies even, they indirectly support a notion of, yes, you could go to shore leave, but it's better to stay on the vessel and work. That indirect notion of not leaving the vessel, that has to change, or making it affordable. Sometimes the seafarers have to decide between paying to get to shore large amounts of money or staying on the vessel. Of course, they're going to stay there and save money. So we need to have smart, there are some startups that have had some great solutions. They work together with malls and shopping centers, which are willing to pay the cab and the vessel for seafarers to get to the mall and back to the vessel. That's practical small solutions we can actually use. Yeah. Full internet access. They need it. All right. Was it Dr. Abila's research that showed what are the most important factors when it comes to mental health? Family and internet access was the second one. Yeah. So internet access is not just connecting to family and friends, of course it is, but it's also the first stop to checking symptoms and looking at videos of people that might be suffering from similar things. It's the easiest thing to do. Or the influencers that you like, or the people that you trust on Instagram or YouTube, they're talking about these things, they're normalizing things, and it makes you feel better because you kind of understand, I'm not the only person suffering from this. Very practical, easy to do. Full internet access for everyone. Seafarers need to be treated like everyone else. Yes, there are dangers when it comes to social media, but it doesn't give us the right to restrict their access and treat them differently than anyone else in the world. Sleep, huge component. What can we do? Simple, small, practical solution when the vessel is in port and it's in operation, it's loading, or we can ask the shipping company's office personnel to go on board and to help the seafarers out during those operations, and the seafarers then can rest. Yeah, we've been barking up the tree of not enough seafarers on the vessels for a long time. That's probably not going to change, but that's something we can do. We can have office personnel go onto the vessel and then assist and support, and seafarers can rest at least while they're on or off boarding, or on or offloading. And of course, medication, it's so simple to just update the medication chest, which is very limited, and there can be so much more there that could help seafarers. And I've been talking to a lot of doctors that agree, because I'm not the medication experts, but they are, and a lot of doctors have been explaining to me how amazing it would be to have just a larger selection of medications to choose from, and it's not that difficult to do. Stakeholders. I think that's a trick question. All of this research is all pointing to one direction. We need immediate change, but I don't hear the big organizations ringing the bells. They're just not doing it. It means we are the ones. We are the stakeholders. Every one of you, everyone here that's listening, the people that actually care and are trying to make a difference. The louder we are, the less likely they're going to be able to ignore us. And eventually, there'll be so much research, they're not going to be able to push against it. But we just got to have hope. We got to continue, and we got to just keep on providing them with more and more evidence. There's already enough out there. Don't get me wrong. There's more than enough out there, but we need to continue until the big stakeholders say, well, maybe you've got a point. Yes, we need to change that. Then it's going to change. We are the stakeholders, because change has been overdue for a long time, and I think every one of us will do their little step and little piece to change this. Thank you.
Thank you very much, Charles, and everyone for providing your good insights on this. And just to wrap up, of course, you have indicated very interesting and feasible practical solutions that can be put in place. And of course, but for that, regulations should be improved somehow, but this is not sufficient. We need to listen to seafarers and to make their voices heard, and to involve families in this. And you have also mentioned about training for seafarers, for the whole maritime industry, about the importance of these matters, and improving their seafarers' working and living conditions in the end, and improving their standards that they deserve to have, like anybody else. So yes, I finished, and I would like to turn over to my colleague, Professor Inga, to provide the final comments and to close the session. Please, Inga.
Thank you. Thank you very much, Maria, and thank you very much, all presenters and participants. So you can see that only working together we can make a change, but we have to be a little bit more proactive, maybe. Not only research, but pushing by other bodies to work together. So although today's session is coming to a close, the initiative we've discussed are still evolving, and our work is far from finished. We hope that this platform has provided a valuable space for sharing insights and ideas, and together we can continue driving positive change in the maritime industry to foster a culture of care. So thank you very much, and see you sometime somewhere.
Thank you, everyone, and the audience. Have a good day.
Thanks, everyone. Bye. Take care.
Thank you.